I am Ramaswamy Govindan, a medical oncologist, a professor of medicine at Washington University in St. Louis. We get asked this question all the time. How long does the infusion last? Infusion for chemotherapy or immunotherapy, and what should we expect? The answer is it depends on the type of chemotherapy and the combinations that are often given. Quite often, we give a combination of 2 or 3 chemotherapy drugs or chemotherapy and immunotherapy drugs. When we give these drugs, they are often given as an infusion. So patients are seated comfortably in a reclining chair or a bed, and with an IV inserted in a peripheral vein or through a central catheter like a portacath. These infusions go on anywhere from half an hour to a couple of hours. Some infusions take a long time. For example, there is a drug called cisplatin we give very often in the setting of lung cancer. When you give cisplatin, we have to give intravenous fluids before, and then give cisplatin, and then give intravenous fluids more to flush out the kidneys so that there is no damage from the chemotherapy. So that infusion of fluids before, fluids after, and also the chemotherapy would take sometimes a few hours longer than some people would like. Sometimes it takes up to 4 to 6 hours. And so it varies. So it's a good idea for patients to ask their physicians or the nurses as to how long the infusion would take so that they can plan transportation, etc. So very often it takes a couple of hours, 2 to 3 hours, if you're giving a set of 2 or 3 drugs. If you're just giving immunotherapy alone, it's often half an hour to 1 hour, and depending on the circumstances. And also, it's important to keep in mind that there are some chemotherapy drugs that are given over a very short time. For example, the drug called vinorelbine is given over a few minutes, and so it's not going to take a very long time. So it depends on the type of chemotherapy, the combinations that are being planned, and also whether there is immunotherapy infusion along with that or not. As for what to expect during this infusion treatments, this is where I do think we have made a remark. We've really made progress in this area, and we don't often talk about that. Oftentimes this is a very boring, banal affairs where people are just sitting there getting infusion, waiting to get it over and go home. This was not the case 20 years ago or 25 years ago, where the chemotherapy would provoke significant nausea and vomiting, and there would be patients struggling with nausea and vomiting while the infusion was going on. And that has completely, I would say, almost completely vanished. And I'm going to say completely vanished with the advent of these wonderful drugs that prevent chemotherapy-related nausea and vomiting, definitely during the infusion. And to a great extent, we've abolished that. Even the type of nausea and vomiting that happens a few days after chemotherapy with some wonderful drugs we have. And so that, I think, is a very, very important thing to keep in mind. And during the infusion, most patients don't have any reactions for most part. Some chemotherapy drugs can cause some mild allergic reactions, and that are effectively managed by our very experienced chemotherapy nurses. Many centers have nurse practitioners on site, and all sites are required to have physicians on site. And so there'll always be somebody to come and help if needed. But for most part, most patients don't have any reactions, and it is a time you spend either watching TV or reading newspaper or talking to your family. And it has become a lot more easier these days for patients to handle.